October is Breast Cancer Awareness Month, and Dr. Marguerite Brathwaite from Innovative Women's Health is here to share important information on the subject. First of all, good morning, Doctor.
Good morning, Elliott. How are you doing?
I'm good. How are you?
I'm good.
Okay, great. So this is obviously, a key topic, and the whole month is dedicated to it. But often there's a lot of not necessarily misinformation, but people misunderstand and don't really seem to be up to speed on it. So who actually is at risk of breast cancer?
Well, breast cancer is 30% of all cancers, but the main thing is about getting early detection. Early detection can save lives. So people who are at risk for breast cancer are going to be people, A, with a family history, anybody with a mother or a sister that has breast cancer or ovarian cancer, or a higher risk of getting breast cancer, as well as if you have a diet full of high fat, obesity, if you smoke, if you had your period early, if you go into menopause late. Those things, having more estrogen exposed to your breast, and there's some non-hormone breast cancers, those people are at risk for breast cancer.
I mean, obviously people would naturally think about mammograms as a way for detecting and preventing, but are there any other signs and symptoms that viewers should be mindful of or check out for that they can do themselves in order to, not pre-diagnose, but be prepared and be on the lookout for?
And that's what I tell my patients, though, because people be like, I don't know what to check on my breast, and I'll say it's not about you detecting breast cancer, it's about you being familiar with your breast. If you never touch your breast, you never know when something feels different to you. So you should do a self-breast examination just so that you know, well, this wasn't here before, I never felt this, just so that you be more familiar with your breast. And combining that with going to the physician and having a breast exam, and then having your annual mammograms after 40. All those things combined together is going to help diagnose or pick up something early. Mammograms don't prevent breast cancer, but it's an early diagnosis and early detection so that you can get treated earlier, you have a better prognosis, so you can, live longer.
Right. You talk about, self-checking, making sure, being familiar with your own breasts. You also talked about people over 40 having annual mammograms. How often should someone get screened, come and see you? How often should they be coming in and being tested and screened and all those kind of things? Is there a set limit? Can they go more often? Should they, if they don't have a history of it in their family, should they branch out for longer? What is your general rule of thumb?
Well, everybody should have their annual GYN exam, and every year you should be checked for have a breast self-examination by your doctor. You'll have a mammogram every 1 or 2 years after 40 years old, but if you have a history of breast cancer, you can actually get a baseline mammogram earlier than that. But everybody, if you have a concern and you feel a lump, or one of your breasts seems bigger than the other, or you have a nipple discharge, or the nipple is inverted, or you may have some breast pain on the side, or any kind of concern in your breast, you should just come to the doctor and be checked.
What is silent breast cancer?
Silent breast cancer is like inflammatory breast cancer, and thank goodness it's not very common. It's rare, about 1 to 5%, but it metastasizes really quickly, and so people can die from it. But signs for that would be like if one of your breasts get 2 to 3 times larger, or it appears red, blotchy, or some people even say that it looks like a bug bite, or the nipple looks different, or discharge is the same lump symptoms, those are things that you should just come and get checked out for.
I think, what this reinforces is the need for people to come and see people, come and see you, have their regular checkups, make sure that they're screened, because there's no avoiding this, right?
Right.
Yeah.
Right. I mean, well, no smoking, and have a good diet, and then all the health factors that you can help to lower your risk and stuff. But early detection is most important. So come to your doctor to get your annual mammograms and your annual breast exams. Will definitely help you save your life.
Now, this isn't just something that you preach about because, preventative care and making sure people are getting checked up. You practice this because recently over the weekend, you were you hosted Caravan for Mammogram, which is an annual event.
Yes.
How was that? And can you tell our viewers about it if they may have missed it over the weekend?
Okay, it was a fabulous event. The community gets together with other health professionals, and we meet at Valley Hospital, and it's just to bring awareness about breast cancer and the importance of mammograms. And everybody comes, and we decorate our cars with things about breast cancer, just pink, you know, the color pink, or in ribbons and bows. And then we all take a drive down to the Strip and from Valley Hospital to Rachel's Kitchen, and just to bring awareness to breast cancer. And so it was a great event. There was a lot of people.
Is it still, you know, part of the struggle trying to get to other people to make them aware of this? Is there still that disparity between you shouting from the rooftops and making sure people come in, you know, yearly?
Yeah, it's because some people are afraid of mammograms, think that the radiation is going to cause the breast cancer, but it's really important to have early detection so that you have a better prognosis and have a longer life. So, you know, African American women still die more often than their counterparts from breast cancer, and probably due to late diagnosis and access to health care. So it's really important that you get the word out so people know how important it is to have mammograms.
Dr. Brathwaite, always informative. Thank you so much. For more information on Dr. Brathwaite's practice, innovative women's care, and to schedule your own appointment, visit